Do you feel unsure of when you can join normal open level group classes after giving birth? Yeah, I get that question quite a lot from my postnatal students. They maybe join the postnatal class once, but they don't. It's not really their vibe because it's with babies, and you can't really focus on your body. And so naturally, you ask yourself, "Oh, when and how can I go back to normal open level classes?" As always, it's going to depend on each and every person, but today I'm going to give some rough guidelines. Please make sure to talk to your provider, of course, individually, and make sure you listen to your own body. So postnatal classes quite often say 6 weeks vaginal and 8 weeks abdominal birth. Even then, of course, take it easy. But in those classes, the teacher already knows what is normally to be avoided, what things to focus on. So you can just kind of go in blindly. In Germany, also, people get reimbursement for what we call Rückbildung. So those are postnatal pelvic floor diastasis focused physiotherapist sessions. And so they already have a good foundation if they've done that to come back into normal classes. Rough rule of thumb is 12 weeks postpartum that you get the doctor's check. They say you can go back to sports. And that's when you feel good, you can start to maybe go back to normal classes. Make sure maybe at first that it's a shorter class. Maybe your endurance isn't there yet. Maybe that it's maybe a slow flow class or a hatha class, a space where you can actually, as moms, you don't have 60 minutes to actually listen to your body. So you might discover things that you didn't when you were just staying at home. And then once you do so, some of the things that we like to avoid are super deep twists, especially close twists. Yeah, these types of things where you really sort of stress the abdominal walls that maybe hasn't fully come back together yet. And it also puts pressure on the pelvic floor. So you can always twist to the more open side, or for yourself, really focus on the upper back, because that's an area that we do need space in. Another thing to avoid are deep backbends. This is another thing that just stretches the front. And because, the belly was big and also chest, the weight was going forward, we're going to have kind of stiff tissues in the lower back. And just taking it into end range and back extensions just reinforces that pattern of opening here and creating space between the rib cage and the hip bone. So postnatally, it's more that we want to reconnect here and broaden the back. So maybe make it more about Sphinx, maybe a cobra where you're focusing more on the back strength, so not really using your hands. And bridge poses, maybe you have a block between the thighs as opposed to a full wheel. And again, you're focusing more on keeping, I'm wearing lots of clothes, the rib cage and the pelvis kind of more compact. Another thing that we obviously want to avoid at first is lots of core work. So in yoga poses, you'll have boat, longer planks, maybe you transition for a moment, that's fine. Crunches, you don't want to see those in yoga classes anyway, me personally. But anything that does this excessively and quickly and burdens the abdominal wall. So what you can do, however, are dead bug type of things. I'm not lying down all the way. Camera is not in the perfect position. I can also pull the heels in towards things like on your back, little marches. So slowly building up the strength there. Side plank variations generally are more stable because we don't have the typical frontal load. But with that, you can also start on your knees before you go up to a full side plank. And last but not least, big stances, warrior two, really going deep into your range, generally deep into your range. because the relaxin, that's the hormone that helped you open up the birth canal, prepare the body and the ligaments loose so that the baby can grow and be born. That's still coursing around the body for until you're roughly 2 years postpartum. So focusing maybe more slowly on strengthening than maybe going back to end range bendy stuff. It's going to, your joints are going to thank you later on. And another thing just about the wide stance, warrior two, etc. is also quite a bit of a load on the pelvic floor. So maybe the stances are a little bit shorter in lunges, in any types of warrior stances, until you feel like you have enough of that engagement so that you don't feel heavy after a class. Okay. And then general rule is also a little bit slower than too fast, too little than too much at once, so that I've had a student recently, she felt completely okay. Diastasis seemed to be closed, but then all of a sudden around 8-9 months, she suddenly felt like, oh my God, I thought everything was okay. So it also depends on the type of your connective tissue. The genetics, do play a big role in it. So take it easy. Can always go to a pelvic floor physiotherapist if you're unsure. And when you go to class, I suggest talking to the teacher ahead of time, just saying, hey, it's my first or one of my first few classes back in an open level class. Just letting you know I'm taking it easy. Maybe you're further in the back. Your balance might also not be where it used to be. You can use a wall to balance. Center of gravity has changed drastically for you. So those are the pointers. Let me know if you have any questions, and I hope you have a wonderful and successful time going back into the normal yoga classes, the open level classes, and hope you get some me time. Thank you very much.